Hi, I'm Ken Vives. I'm one of the neurosurgeons here at Sarasota Memorial Hospital, and I specialize in functional neurosurgery. I'm the director of advanced neurosurgery here, and I'm here to answer questions about deep brain stimulation.
Thank you so much for joining us today on SMH's Ask an Expert. What is DBS?
Well, DBS is deep brain stimulation, and so it's a technique where we use electrical stimulation to stimulate areas of the brain deep inside, hence deep brain stimulation. And so this electrode, it's a little bit thinner than the refill for a ballpoint pen, and that goes down deep inside the brain, comes out through a small hole in the skull, and then there's a wire that connects it underneath the skin, down behind your ear, to a generator that's here underneath your collarbone. And this allows us to provide electrical stimulation to target areas of the brain to help change the way the brain functions.
Does someone have to be diagnosed with Parkinson's to receive this therapy?
So Parkinson's disease is one of the main reasons we do this therapy, but there are a few other reasons that we might be able to do deep brain stimulation. So essential tremor is another movement disorder that we commonly implant patients with DBS for. Then there's also things like epilepsy that just was recently approved by the FDA for us to treat the patients with that. And then there's some experimental conditions that we can also consider implanting patients for. But patients with Parkinson's disease or essential tremor or epilepsy, all of them need to have tried medications first and really be considered medically refractory before we would consider any kind of surgery for them.
Can you review what treatments should be tried before the DBS?
So again, it's different for each individual disease that we might be treating. But for patients with Parkinson's disease, these are patients that typically are on a combination of levodopa and carbidopa. This is a very common combination of medicines that are used for these patients. And they should have been tried on this and be found to still have motor symptoms that persist despite optimal medical treatment. So patients may take their medicine and have too much movement, and then they have a period of time where they're doing pretty well, and then before their next medication dose, then they have too little movement. And so this up and down pattern, if patients are experiencing that and it's disabling for them, that's the time that we can start considering whether or not DBS would help them.
Great. Are there risks or side effects to DBS?
So thankfully, DBS is actually very safe. We have a bleeding risk rate much lower than 1%. And even if patients do have bleeding in the brain from it, usually it is something that is relatively well tolerated. It's extremely rare to have a bleeding event that's actually going to cause a permanent problem. Infection is another risk. This does happen in patients, about 1 in 10 to 1 in 5 patients. The infections are rarely ever life-threatening, but it can be a little bit inconvenient because sometimes we have to take out some of the hardware as a result of the infection until the infection clears before we can put it back in.
Is there an age limit to receiving DBS therapy?
So the answer to that is really absolutely not. And especially, I see patients in the office that are healthy 96-year-olds, and they're healthier than just about anybody else I know that maybe even is still in their 40s or 50s. And we see the opposite end as well, and there are some patients that are debilitated. Problems like poorly controlled diabetes or poorly controlled hypertension or the need to use blood thinners can be hurdles that are difficult to overcome to do the surgery. But in general, there's no absolute age limit whatsoever.
How long has DBS been available?
So DBS became available through the FDA in 1997. Of course, before that, there were some experimental studies going on trying to measure how good it worked and how safe it was to do it. Prior to DBS, we were actually making lesions in the brain in some of the same areas that we're now treating with DBS. And DBS is seen to have a big advantage, especially for something like Parkinson's disease, which is a progressive disorder. DBS allows us to kind of change the parameters of the stimulation over time so that as patients' disease progresses, then we can keep up with the disease by reprogramming the stimulator. Before this, with lesions, if their disease progressed and they became symptomatic, we had to do another operation and make another lesion. So it's a big advantage with this newer technology.
Wow. Are there many hospitals in the area which offer this therapy?
So there is a program down in Fort Myers as well as up at Tampa General, but in the rest of Sarasota area, we're the only hospital currently offering this.
Is DBS covered by insurance?
So for the common reasons that we were doing DBS, as long as we do careful documentation of the patient's condition, in general, it is covered by insurance. So things for like Parkinson's disease, as we document that the medications aren't working properly. For essential tremor, that despite medication, that the patient can't do their activities of daily living. For epilepsy, despite multiple medications, the patient's still having seizures. As long as we document that, there's not a problem with the insurance companies.
What type of doctor performs DBS?
So it's a neurosurgeon that has special training in functional neurosurgery, and specifically this technique. It does require some experience to know how to do this, and even more importantly, know when we don't actually see what we're expecting, how to change things so that we get an optimal treatment for a patient. But it really takes a whole team of people to do this here at Sarasota Memorial Hospital. So we have dedicated neurologists, neurophysiologists, anesthesiologists, nurses, and even rehab specialists who help patients get through the whole therapy and make sure that they have the best outcome that we can offer.
And who should I speak with if I'm interested in DBS?
Most of the patients that I end up talking to are referred from their neurologists that are treating their condition. Some patients are referred directly from their primary care physicians who may be taking care of them as well. I do educational seminars out in the community, so you can kind of look for one of those. Or if you really do have a problem that you think that I might be able to help with, I can see you just directly in the office.
Great. Is there anything else you'd like our viewers to know?
This is a wonderful therapy, and patients do incredibly well with it, and it's really quite safe. It changes patients' lives, and it's really, for me, I'm passionate about doing it because it's part of my training, but I'm also passionate about doing it because I see how well patients do with it. There are other things coming on the horizon. Like I said, we got approval for epilepsy just recently, but there are other conditions where we can use this same tool to affect people's lives. And so I'm looking forward to being able to offer that to other patients in the future.
Thank you so much.